Welcome to Word of Mouth, where dentists talk about how oral health is related to overall health, which is also known as the oral systemic connection. The information provided on this video is not intended as medical advice and should not be interpreted as such. If you seek medical advice, please consult with a healthcare professional. Also, the information in this video represents the thoughts of the individual speakers, and the views expressed in this interview do not necessarily reflect the views of the IAOMT.
So, welcome to Word of Mouth. We're here today with Dr. Johann Lechner, who is a member of the IAOMT. I'm Dr. Michael Gosweiler, also a member of the IAOMT, and also one of the members of the Fundamentals Committee. We are here today to talk about NICO and fatty degenerative bone lesions with Dr. Lechner. Welcome, Dr. Lechner. Glad you're taking the time. It's my great honor to be able to talk to you today. So, one of the things we would like to first cover is your background and how did you get started in biologic dentistry coming from a traditional background?
Basically, it might be an intuitive decision. But I started my dental work in practice with other dentists who already were practicing this holistic aspect. And what I could see is removing a root filling here and doing a cavitation there. The patients could walk again, they lost their eye problems, and so on and so on. And by these events, of course, I got interested in also in the medical and scientific background.
So you had in your training, you had a medical background prior to coming to dental school, or?
No, when I finished dental school.
When you finished dental school.
When I finished dental school, I was interested in this aspect, more intuitively.
Right.
But I must admit, especially in Germany, we have a great tradition of these holistic aspects.
Yes.
Including homeopathy.
Right.
And so on.
So you had already been exposed to that prior to going to dental school then?
Yes.
Yes,
yeah.
okay.
So I got contact with Dr. Issels,
okay,
which is also known here
yes.
in the US.
Right.
Later, when I had my own clinic, I worked together with Dr. Issels.
Ah, okay. So then when you started this, you would observe these, but then how did you then start to move into doing cavitations?
Yeah, these cavitations, where the German name is Kieferostitis, was practiced for ages in Germany.
Yeah.
And there was the theory that many diseases could be cured, eliminating this Kieferostitis.
And so when you started out in this, did you have a lot of resistance? Were there a lot of people who were skeptical or that were pushing back against this this idea that you had that this was somehow connected with these other problems?
That's a good question. Nevertheless, the individual success,
right,
the individual healing processes we induced and we had, from official sides, we got resistance. And this was basically the reason why I concentrated in this scientific work I just presented in the
to give it some
media.
validity with the medical
and to build up scientific credibility.
Right.
And I always say to save myself
in
my everyday work.
Very good. So I noticed that you've done a lot of work with Volker von Baer in Berlin. How did that connection come about?
Volker von Baer is one of these immunologists. He owns a big lab in Berlin, who was open to our ideas. And for these phenomena, we didn't have any explanations on a biochemical level.
Right.
He gave us a chance to develop lab mechanisms, lab processes, where we could verify that this, what we are thinking or what we are doing, can be proved by lab data.
Very good. So this then developed into this whole series of papers that you've published, and we had a nice presentation that you had done previously. And I noticed, of course, that from the literature that I think it was like half of the articles on this were published by yourself as at least one of the co-authors on these papers. Why is it that you think that there really hasn't been more of an interest in this? I mean, you know, you were pointing out in some of your presentations that there's certainly connections here, but there really doesn't seem to be very much interest in the outside of probably a rather small group.
Yeah, you're right. In the moment, this is true.
Yes.
Yeah, but with these scientific papers, I presume we have now the weapons to against all these resistances.
Ah, okay.
We saw, and I think the problem is just that medicine is organized in very, very specific lanes, and doctors don't love to leave their lane.
Right. So it's this kind of, if I can interpret, this kind of silo mentality that we have these types of lesions and there's really no other connections anywhere else.
The question is, how do you get people open-minded?
Right. So I'm just going to go into some speculation on your part about these things because I know your research interests are very specific. But you had mentioned in your lectures about the how the levels of RANTES in some of these lesions were much higher, for instance, in the bone lesions in the jaw versus even found in breast cancer patients. So what do you think that it is physiologically about the bone of the jaws versus, say, breast tissue that maybe is causing this concentration of this type of thing? Any
this is just the comparison between these concentrations.
Right.
They found it in breast cancer,
right.
We found it in jawbone. And the question is, which aspect could influence the other one?
Right.
And so it's a question of concentration. Where does the concentration go to? And the main aspect of this is the chronicity.
Right.
And the subtle element that nobody is really aware of this process. And I think we have, in the climate change, we have a good example. It's not one eruption of a volcano which is damaging the climate for several years, but then it goes back. But these are all these hundreds of billions of subtle inductions, of subtle provocations, which change a biological system. And for me, a biological system, the human body, reacts in a similar way as the climate. So what we should take care of is just to take away all these subtle, really not acute
insults.
Patient doesn't feel it.
Right.
But at the end, it sums up, and then the whole system
breaks
changes
down
or collapses or breaks down.
So what would be some of these subtle injuries that you refer to?
Thank you for the question.
Yeah.
I don't want to be monomanic and just concentrate on these jawbone cavitations.
Right.
Of course, it's heavy metals in the mouth, blocking enzymes, creating these oxidative stress. It is malnutrition. It's, of course, also root fillings, toxins, which might come out. It's even, in my eyes, the psycho-emotional background. That means bad negative sentences, bad negative emotional programming.
Right. Start to add to that because it starts to affect this balance between the sympathetics, parasympathetics, perhaps?
Yes. That's the point. Chronic stress.
Right.
Chronic stress brings up the sympathetic stress.
Right.
And without the parasympathetic relax,
right,
your body exhausts.
Can't heal properly. Yes. Very good. So one of the kind of exciting developments, I think, in at least for a clinician as myself in trying to diagnose these things, is the ability to be able to start to diagnose these types of lesions in a non-invasive manner. certainly the CBCT has been a useful tool, but of course one of the problems is that if we want to go in to reassess or to check these areas, we have to employ radiation each time that we do so. So many years ago we had this machine called the Cavitat. Now you've essentially kind of brought this machine back with some modifications called the Cavitao.
Yeah.
Tell us about this and how you decided to bring this back.
When I was in the US 20 years ago,
Yes.
I saw the Cavitat, the old Cavitat.
Right.
I bought 2 of these machines because I was fascinated by this idea to do dental diagnostic without radiation, and especially built for these jawbone cavitations. And unfortunately, the company was closed down for whatever reasons. And so to keep up the interest and to keep up the possibility to demonstrate or to document these jawbone cavitations by pictures made me develop my own Cavitat machine. We call it now Cavitao. Tau means transalveolar ultrasonography, because just in contrast to the normal use of ultrasound machines in medicine, we are not working with reflections. We have to send the waves, the ultrasound waves, through the bone, and this makes it more complicated. But the use of ultrasound in medicine, the harmless use,
It's well
this
known.
is proven.
Yes.
This
Yeah.
is well known.
Right. Yes.
No problem at all.
So the where do you see this perhaps headed in the future now? The Cavitao, if this is, we hope, eventually approved for use here in the U.S., where do you see your research going in the future? I mean, do you see the Cavitao as part of that, or is that
no?
or is that just-
The Cavitao is my personal
Right.
main focus now,
Okay.
of course. And we have we want to cover 2 items.
Okay.
Item number 1 is why I'm here inside the IAOMT, inside a group of holistic thinking dentists. And the other group is where we are aiming to are the implantologists, because this is also well proven and well known. A lot of implants fail because the bone is not healthy, which has to bear the implant. And there are also scientific research, not from me, but from German universities. And here we give the implantologist a tool where he can check the intensity of the bone density before he does the implant, and the implant doesn't just drop out again.
So I guess I'm looking at this from the standpoint of then research and outcomes, because this I think this would be, very frankly, a very useful tool for researchers to be able to conduct prospective studies on this then. Have you made any connections with any universities in Germany or
We
the
are
US?
about. We are about. We
You're
have
about
2
to.
universities, 2
Okay.
professors who are working on this.
Okay, very good.
1 pathologist, and one of these guys already was.
Yeah, you don't have to
studying.
reveal any names. But
And but the pathologist is already working with our machines, because he's working on dead bodies. Because we have to wait another 4 weeks to get the official approval. As long as we don't have the official approval, the other professor cannot work on his patients.
I see. Okay. Yeah.
This is not allowed.
Very good.
I'm
So-
allowed to do this
Right.
inside the research. Of course, we measure for more than 1 year now at our patients the validity of our ultrasound machine.
Very good.
And we compare it with CBCTs,
To
the Hounsfield units.
right.
We have a great possibility to precisely build up a logarithmic figure with each area we measure in this ultrasound machine, and then we precisely compare these Hounsfield units with these our logarithmic outcome. This is a very scientifically based approach.
Very good. Any other things you would like to add before we wrap up our lecture?
Yeah, I hope that this ultrasound machine contributes to a wider aspect. That the problem in the education of dentists is that they suppose teeth are independent from the rest of the body. And this is an aspect which modern medicine basically can easily contradict, especially by this tool I use, the cytokines, measuring the cytokines, because cytokines are an instrument where the body works from top to toe.
Right, it's
each organ is involved in this pattern.
Right, it's a communication tool that affects various areas of the body.
Exactly.
So, well, very good. So, thank you very much, Dr. Lechner, for your time. So, for those of you who'd like more information, please go to wordofmouth.iomt.org. There you can find more information on this and other topics related to biologic and holistic dentistry. Thank you.
This podcast has been brought to you by the International Academy of Oral Medicine and Toxicology, the IAOMT. The IAOMT strives for safer dentistry and a healthier world. We are a network of over 1,000 dentists, health professionals, and scientists who research dental products and practices, including the risks of mercury fillings, fluoride, root canals, and jawbone osteonecrosis. We are a nonprofit organization and have been dedicated to our mission of protecting public health and the environment since we were founded in 1984. You can learn more about us at www.iaomt.org and www.thesmartchoice.com. The information provided on this video is not intended as medical advice and should not be interpreted as such. If you seek medical advice, please consult with a healthcare professional. Also, the information in this video represents the thoughts of the individual speakers, and the views expressed in this interview do not necessarily reflect the views of the IAOMT,